hard by the coronavirus, reporting more than 120,000 cases since late January, according to the World Health Organization. But the number of deaths in Germany has remained lower than many other countries, whether in Europe or around the world. Joining us now to discuss is Germany's Minister of Health, Jens Spahn. Mr. Spahn, thanks so much for joining us. Good afternoon to you.
Good evening from Berlin. Hello.
Let's start on that topic that I just mentioned, if we could, whether we're looking at total cases relative to population, or in particular the number of deaths so far in Germany. It's a terrifying number in absolute terms, but relative to so many similar countries, you've clearly performed a lot better than some nations. Why do you think that is?
Well, Wilfried, in general, first of all, the fact that Germany is doing better so far makes one humble, not overconfident. And there are many reasons for it. I will just outline two or three. One is that we have a healthcare system that is in very good shape. And that is because of a success story, actually, of several governments. We invested in it too, but that is already a good base for many, many years. Secondly, we have a good network of general practitioners here in Germany. They take care of the soft cases to avoid an overrun of the hospitals. So the hospitals can take care of the severe cases. And then, traditionally, we have a high number of ICU capacities here in Germany. We have managed to increase it now in the crisis up to 40,000 ICU beds here, and that is a high number for a country like Germany. So we took it very serious from the very beginning, and that gave us time to prepare.
Oh, it seems as well that your testing capability has been far superior to that of perhaps the United States or the United Kingdom. Why is that? Were you already prepared for this in years past, or did you just manage to ramp up capability very quickly in the early months of this year?
Well, first of all, testing is crucial. It's like pointing a flashlight into the dark. If you don't do it, you just see different shades of gray. With extensive testing, you can really see what's going on. You don't just see the symptomatic cases, but the mild and asymptomatic ones too. And so far, we have tested 1.5 million Germans here, and we are trying to increase capacity day by day. What helped us is from the very beginning that we have a broad network of labs, laboratories all over Germany, traditionally as well. So actually that helped us from the start, and actually the first test in the world for coronavirus, for this one, actually was developed in Germany.
And so, Mr. Spahn, do you think that we're getting closer to a point when Germany will be able to reopen its economy? There's been sounds of good news on that front coming out of Germany in the last week, and then yet just today, about an hour or two ago, President Macron of France clearly pushed back the date for France. So where does Germany stand?
Well, so far we have managed through it very well, but now we need to find the right balance. It's not, I would say it's not the health of people versus the economy, because they are very much interlinked. You need a strong economy to have a well-equipped health system, for example, or unemployment recession is harmful for the mental and physical health of people too. So what we need to find is the right balance. And now with numbers down, the numbers of new infections per day in the past weeks, with all the measures that we have taken, we are thinking about step by step, that is important, step by step going back to a new normal. That is important too, because all the measures we have taken, like keeping distance, wearing masks, no parties, that are definitely measures that need to be there in place for months to come. And I'm very proud that our fellow Germans actually follow the rules, actually not because the government tells them to, but because there's a broad support for this. And that is, of course, very helpful, and that gives us confidence now, step by step, coming back to, as I said, new normal.
Mr. Minister, it's Sarah Eisen. It's good of you to join us. We're also wrestling here in the U.S. with the question of how and when to reopen the economy and get people back to work. I know you guys have done some